Yeah. Hello. Yeah. Oh. What?
All parents have questions about caring for their new babies. Naturally, many of these questions are about feeding. After all, feeding babies is almost the first thing we do for them. It's important to remember that not every baby is ready
Are you
to
still
nurse
hungry?
right away. So be
Are you still
flexible in your
hungry? Yeah.
expectations. As you're becoming comfortable holding your baby, he is learning how you feel and how to begin breastfeeding. While it looks easy enough, it's a learned skill for you and your baby. Fathers can play an important role in the healthy nurturing and emotional growth of their babies. Your baby will quickly develop a sense of trust in the people who answer his cries, hold him, play with him, and make him comfortable. When your baby is at your breast, he's close enough to focus on your face, and he's learning to associate your presence with the good feelings of sucking and being fed. And you're developing confidence in your ability to care for your baby. Your first milk is called colostrum. It's present in the breasts from early in pregnancy. This rich yellow substance is high in protein and calories and full of antibodies, which give passive immunities to the baby. Colostrum loosens extra mucus babies have at birth and helps clear the digestive tract of meconium. Babies may lose up to 10% of their birth weight during the first several days of life. Then they should quickly start gaining weight. Breast milk contains all of the nutrients your baby needs, the perfect proportions of proteins, fats, carbohydrates, vitamins, and minerals are easily digested. In addition, breast milk also contains antibodies which protect the baby against many diseases while he is breastfed. The reflexes your baby is born with affect his ability to nurse. These include rooting, sucking, and startle reflexes. The rooting reflex can be seen when the baby's cheek or lip is touched. The baby opens his mouth and searches for something to suck. When anything touches the tip of the tongue, the baby sticks out his tongue and searches for something to suck. Touching the middle of the tongue or the roof of the mouth causes the baby to stick out more of his tongue and begin to suck. If your baby is not interested in nursing, playing with him in this way may get him interested. The startle reflex is seen when the baby feels as if his head is falling. His arms may fly out and his jaw reflexively bites. This may happen when the baby is nursing if his head is not well supported or when the baby is being taken off the breast. To get the colostrum and later the milk, the baby must have the breast far enough back in his mouth so that he can compress the milk reservoirs behind the nipple. His tongue is cupped under the breast to press it against the roof of his mouth. When you're ready to nurse, the first thing to do is get comfortable. Make sure your back and the arm with which you hold the baby are well supported so that you can get your baby close to the breast. Mothers usually nurse their babies in the cradle position, the football hold, or lying down. You can cradle the baby in your arm on his side facing the breast he will be nursing. Put one of his arms on either side of your breast so he's hugging you. This brings the baby's shoulders forward and helps to control the startle reflex. Line up his lips with your nipple. Pull him toward you so you are belly to belly with his head and body in straight alignment. As the baby nurses, you should feel a rhythmic tugging on the nipple, but no pain. Many mothers prefer to begin nursing using the football hold. In this position, it's easy to see the baby's face, and this is usually the most comfortable position following a cesarean section. The baby lies in your arms supported by pillows, with his head in your hand and his body beside you. Place his hands on either side of your breast so the baby is hugging you. Draw him toward the breast so that his mouth is lined up with your nipple. You may want to lie down to nurse, especially for night feedings. Lie down on your side with a pillow at your back and the baby on his side so you are facing each other. Place a rolled-up receiving blanket or towel against the baby's back to keep him on his side so he won't choke if he spits up. Don't worry about falling asleep. The nipple will automatically soften and the milk will stop flowing when the baby stops sucking. In the hospital, have the bed railing up and a pillow against it to protect the baby from falling out of bed. To help your baby latch on, hold your breast with the palm of your hand underneath and your thumb on top, behind the areola, the dark area around the nipple. Compress the breast. The palm of your hand under your breast will support it and hold it at the baby's lower lip. Now, stroke the baby's lips to elicit the rooting reflex and get his mouth open as wide as possible. Aim the nipple for the back of the mouth. The baby's tongue will come out and pull it in and he will latch on. Get as much of the breast into the baby's mouth as possible. You may need to hold down his chin to position his tongue for him. Usually, the baby's nostrils will flare out so he can breathe. If not, depress the breast with your thumb just under the baby's nose. The milk is let down from the milk glands in response to the baby's mouth on the breast. The sensation of letdown varies. Some mothers may not feel the letdown, but will know it has occurred when the baby begins to swallow more rapidly. You may also experience a warm, relaxed feeling caused by the hormones which stimulate milk production. You should support the breast throughout the feeding unless the baby makes it obvious that no help is needed. Holding the breast will keep it in place and minimize nipple soreness. Before taking the baby off the breast, hold the baby's head still. Slide a finger into his mouth between the gums and leave it there while you remove him. Remember, newborns bite reflexively when their heads are moved. Your baby will probably nurse for about 15 minutes on each breast at each feeding. Many babies need to be burped after each breast. The baby can be held on your shoulder. You can sit him in your lap, or you can lay him face down across your lap and gently rub or pat his back to help him burp. You should start feeding on the fuller breast because the baby sucks more vigorously at the beginning. You can feel which side is heavier. If the baby falls asleep in less than 10 minutes of nursing, he has probably lost his hold on the nipple and needs to be stimulated and latched on again. During the first few days, your baby will probably not recognize hunger, but he will nurse to satisfy his sucking need. If your baby is very sleepy, play with him to wake him up by rubbing his back and chest and talking to him. If your baby has slept past his usual feeding time during the day, wake him to eat. At night, you can let your baby wake you. This way, you will encourage daytime feeding and nighttime sleeping. In the first few weeks, most babies need to nurse every 2 to 3 hours, counted from beginning of one feeding to the next. Later on, they'll nurse less frequently. The fat content of your milk increases through the feeding. First, the baby gets a rush of lower fat milk, and the longer he nurses, the higher in calories the milk becomes. By nursing about 15 minutes on each breast, the baby will get the rich hind milk. Otherwise, he'll probably want to nurse again soon, or may not gain weight well. Your milk supply will meet the baby's demand. When milk is removed from the breasts, more is made. Therefore, skipping a feeding can decrease your milk supply. Most women are producing 28 to 32 ounces of milk per day by the time their baby is 2 weeks old. It's important to drink when you're thirsty. You'll probably find that you drink 2 to 3 quarts of liquid a day. Many women find they lose their extra pregnancy weight easily. even though they have to add about 500 calories a day to their usual diet while nursing. Your baby will go through growth or appetite spurts when he will nurse more frequently for a couple of days to increase your milk supply. Typically, these occur at 6 to 10 days, 6 weeks, 3 months, and about 4 to 6 months. After your baby nurses easily and your milk supply is well established, missing or delaying of feeding is less critical. Many babies never use a bottle but wean to a cup. However, if you want to introduce one, offer it when the baby is not hungry, so he's less likely to get frustrated learning a new skill. If you miss a feeding fairly regularly, but don't wish to wean from that feeding, you will need to express or pump while away from your baby. Prenatal breast preparation has not been found to prevent sore nipples. However, you can minimize tenderness by making sure the baby is positioned correctly and latched on so that he is not sucking on the tip of the nipple but is farther back on the breast.
You're clucking. That's wrong.
If nursing is painful after the initial latching on, pull down on the baby's chin to open his mouth wider. If your nipples have gotten sore, gently dry the baby's saliva off the nipples and rub a little breast milk into any sore area. Also, try nursing the baby more frequently because he will suck less vigorously when he's not overly hungry. Avoid using creams which can block the Montgomery glands, the small bumps on your areola, whose oils keep the skin clean and soft. If your nipples are very sore, you can wear breast shells inside your bra to keep the pressure of the clothing off the nipples.
Between feedings, if you wear these until your nipples heal up, it'll feel a lot better. Do you want to just close your bra over that? Okay.
Not all nursing mothers wear a bra. If it doesn't make you more comfortable, you don't need to wear one.
Does that feel better than that bra? Than the bra dressing on the nipple?
It feels a lot better.
Okay.
Engorgement may be a problem. About 3 to 5 days after your baby is born, your milk comes in. You may notice that your breasts become larger and heavier, and your baby may be gulping the milk as he nurses. Some mothers may never become engorged. If you do, your breast tissue will swell because of the pressure of more milk in the ducts and your body's response to the hormone prolactin. The breasts will feel hot, hard, and swollen. With careful management, this usually lasts only 12 to 24 hours. When you're engorged, getting the milk out of the breasts will relieve the pressure on the breast tissue, so it'll stop swelling and you'll feel better.
Pump your breast a little bit and soften it, and then she'll be able to. Can we give you to your auntie here? There we go. Okay, well, let me just bring in the pump here.
If you're too engorged for the baby to latch on, pump or hand express milk to soften the breasts. Ice packs on the breasts for 20 minutes or so will feel good and will help reduce the swelling. Some mothers find that warm compresses or a warm shower before feeding will cause the milk to flow, softening the breasts for feeding. There are several ways to tell your baby is nursing correctly and getting enough milk. You'll notice that he's nursing steadily, in bursts of 10 to 20 sucks with his arms and shoulders relaxed, and that you're feeling a tug, but not pain, on your nipple. The breast will move with each suck, but your nipple will not slip in and out of his mouth. He is swallowing as he nurses, and your breast is getting softer. While he's sucking, the baby's cheeks are rounded, and his jaw is gliding, not chewing. After the feeding, his mouth is wet. By the time he is 4 to 5 days old, he should be having at least 6 to 8 wet diapers and 1 or 2 bowel movements each day. Your baby's only language is crying. Every cry is not a hunger cry. Some babies will even learn to comfort themselves. You'll soon learn to recognize different cries.
You all wet? Yeah, you all wet.
If you have nursed the baby within the last 2 hours, Try other forms of comfort before offering the breast. Although feeding is important, babies need many different kinds of care and respond to the people who answer their cries. Feeding is one of your baby's most pleasant experiences. Being held and being fed tell your baby that he is cared for and loved. You may choose to combine breastfeeding and bottle feeding. If you want to give your breastfed baby a bottle for some feedings, wait 4 to 6 weeks until breastfeeding is well established. Learning to drink from a bottle is different than breastfeeding. It may take your baby several tries before it is easy to drink from a bottle. Your baby may find it easier to learn to take a bottle if you give it between feedings when the baby is not hungry. You can hand express or pump breast milk to use in a bottle. You can also choose formula for bottle feedings. If your baby has only an occasional bottle of formula, your breast milk supply will be unaffected. However, if you give your baby a bottle of formula at a specific feeding time for several days, your body will adjust and produce less milk at that time. If you want to substitute a bottle of formula for breast milk at a second feeding, wait several days until your breasts are comfortable during the first feeding time. In this way, you can choose to keep breastfeeding as much as you wish. Your body will make milk when your baby nurses.
How you doing? Good?
Feelings of warmth and closeness are an important part of feeding your baby. Infant formula is especially designed to meet your baby's nutritional needs, but feeding involves more than just providing food. It's the most frequent and regular social interaction your new baby takes part in. The baby should always be held for feedings. The reflexes your baby is born with affect his ability to eat. These include rooting, sucking, and startle reflexes. The rooting reflex can be seen when the baby's cheek or lip is touched. The baby opens his mouth and searches for something to suck. When anything touches the tip of the tongue, the baby sticks out his tongue and searches for something to suck. Touching the middle of the tongue or the roof of the mouth causes the baby to stick out more of his tongue and begin to suck. If your baby is not very interested in eating, playing with him in this way may get him interested. The startle reflex is seen when the baby feels as if his head is falling. His arms may fly out and his jaw reflexively bites. Cradle your baby in one arm with his head nestled against your chest and his head and chest aligned. This position allows him to feel secure and relaxed as he eats. His shoulders should be rounded slightly forward and his head should be slightly higher than his belly. At first, you may need a pillow or a folded blanket in your lap to help support the baby so your arm doesn't get tired. Tilt the bottle so that formula fills the nipple. Doing this prevents the baby from taking in too much air as he drinks. At first, your baby may only take 1/2 to 2 ounces at each feeding and may eat every couple of hours. But by the time he's a few weeks old, he'll probably take 3 to 4 ounces and eat every 3 to 4 hours. Later, he'll probably take 4 to 8 ounces at a feeding and go a little longer at night. These feeding times and amounts are only guidelines, however. Babies need to be fed on demand, and their schedules are often irregular, especially at first.
Can I have this? Just
Babies usually swallow some air as they feed and need to be burped during and after each feeding. There are several ways to burp your baby. Experiment with them and decide which works best for you and your baby. Lay him face down across your lap, or you can hold him up to your shoulder. Or you can sit him up on your lap with a hand supporting his head and chest, then pat or rub his back. Your baby may spit up a little formula as he burps. This is completely normal. He may spit up a little more when he goes to sleep after his feeding. It's best to lay him on his side or on his stomach with his head turned to one side. A rolled-up receiving blanket or towel at his back will keep him from rolling onto his back in his sleep. If he spits up in these positions, the formula will run out of his mouth and will not choke him. In the first few weeks, as you and your baby get used to one another, you'll learn to interpret his cries. Not every cry means hunger.
You never cry. What are you doing now?
Your baby also cries when he needs to be held, or burped, or have his diaper changed, or is simply bored.
What's the matter? You're hungry. You're still hungry. I know you are.
Babies suck when they feed, of course, but many babies also suck for pleasure or comfort. If your baby is fussy and rooting, he may need some comfort sucking. Encourage him to suck on his own fingers or a pacifier. If he calms down, you are right. He's not hungry yet.
Was that good? You feel better now?
Your baby will
Did Dad
learn
get
to
a kiss?
trust the people who answer his cries. And fathers can play an important part in feeding and nurturing a new baby.
Runner.
Whether the father actually feeds him or simply comforts him and brings him to you for feeding is not that important to your baby. Although the constant demands of a small baby may seem overwhelming, you should never prop a bottle for feeding because the baby could choke. It's important to give him this time during feedings, not only for his nourishment, but for the social interaction. New mothers and fathers often have questions about preparing formula. Your pediatrician is the best source of counsel on your baby, and he or she may recommend that your water supply is safe enough for formula preparation right from the tap. If you need information on sterilization procedures, ask your pediatrician for the booklet, How to Prepare Infant Formulas. Many people find powdered formula, which can be mixed up one bottle at a time, very convenient. Bottles can be filled with pre-measured amounts of water so you can mix each bottle as needed, or a day's supply can be prepared at one time. When mixing powdered formula, it's always best to pour the water first, then add the powder. It's important to check the can label for directions, but generally, for each 2 ounces of water, you add 1 scoop of powder and mix well. Once powdered formula is mixed, it should be refrigerated and used within 24 hours. If you're using liquid formula, wash the top of the formula can and the can opener with hot soapy water and rinse before you open it. Liquid concentrate comes in 13-ounce cans. An equal amount of water is added so that 1 can makes 26 ounces of prepared formula, enough for 1 whole day's feedings for most infants early in life. After the formula is mixed and the bottles and nipples are washed, fill each bottle with enough formula for 1 feeding and cap. Store the filled bottles in the refrigerator until it's feeding time. Individual bottles can be prepared by mixing equal amounts of liquid concentrate and water. The concentrate must be refrigerated and used within 48 hours once the can is opened. Ready-to-feed formula requires no mixing and comes in 8 and 32-ounce cans. Once a container of ready-to-feed formula has been opened, it must be refrigerated and used within 48 hours. Many kinds of bottles are available. You'll want to choose one you can clean easily between uses. Bottles which use disposable plastic liners are also available. Nipple rings hold the nipple on the bottle, and nipple covers keep the nipple clean during storage. Several types of bottle nipples are also available. An orthodontic or natural nipple is shaped like the mother's nipple after it's molded to the baby's mouth, so the baby uses his mouth and tongue almost as though he were nursing. Traditional bottle nipples are straight and have a longer shank. Experiment with several nipples until you find the one your baby prefers. Many babies don't mind their formula cold or at room temperature. If your baby prefers his formula warm, you can warm it by standing the bottle in a bowl of warm water. Never heat bottles in a microwave. Even though the bottle itself and the first drops of formula may feel cool to the touch, the milk may be hot enough to scald the baby's mouth. Before beginning the feeding, check the temperature of the formula on your wrist. You should also check the rate of flow of the formula through the nipple to see that the milk is coming out at a rate the baby can swallow easily. It should flow at about 1 drop per second when the bottle is turned upside down. If it flows too fast, replace the nipple. If your baby doesn't finish all the formula in the bottle at a feeding, you should throw away the remaining formula. The formula in the bottle has mixed with the baby's saliva during the feeding and may spoil within an hour or so. The amount of formula fed in 24 hours varies according to the age of your baby. If your baby eats 6 to 8 times in 24 hours, you may want to fix 4-ounce bottles. If your baby eats 4 to 5 times in 24 hours, you may prefer 6-ounce bottles. Infant formula is designed to meet the special nutritional needs of the baby during his first year of life. Fats, proteins, and carbohydrates are included in the proper proportions. Regular cow's milk, skim, 2% or whole is not balanced in this way and should not be given to your baby during his first year. Infant formula also contains all the vitamins and minerals your baby needs. However, if you're mixing the formula with unfluoridated water, your pediatrician may recommend a fluoride supplement, since the baby's permanent teeth are forming during this time. As your baby grows older, you may want to hold him on your lap so that he's facing you during some feedings. Whether you hold him like this or cradled in your arms, it's important that he be able to focus on your face and to hear your voice. He'll enjoy being talked to as he eats.
Is that good?
Your baby won't need any solid food for the first 4 to 6 months. Some signs that he's ready for solid food are sitting steadily and reaching for and bringing things to his mouth. At this time, the baby's tongue develops the ability to thrust out and pull in a small amount of food instead of pushing it out. When your baby starts to drink from a cup during the last months of his first year, you should still give him formula, not regular cow's milk to drink. Wait until he's at least 1 year old to switch to regular cow's milk. By paying special attention to feeding your baby during his first year, you're providing him with a good nutritional and emotional foundation for life.